A few weeks ago, I made a video about 7 signs of aging well. Thousands of you did the tests along with me, and many of you told me in the comments how you got on. Something struck me in those replies. A great many of you said the same thing in different words. You said you had no idea any of that could be measured. Nobody had ever shown you. So today, I want to give you 5 more. And I want to be clear at the start. These are not the same 5. There is no overlap with that video. These are 5 different tests from different parts of the medical literature measuring different things. One of them is used in emergency departments and physical therapy clinics every day. One of them was published in The Lancet as a single paragraph, and it is still used 30 years later. One of them is the single strongest predictor of whether you will still be living in your own home in 10 years. And one of them, I suspect almost nobody watching has ever heard of. You can do 4 of the 5 right where you are sitting. I will tell you which one to be careful with, and I promise you this. If a test does not go the way you want, I will tell you exactly what to do about it, because every one of these 5 is trainable. Not one of them is fixed. Let me start with the one that has the most striking data behind it. Number 1 is getting up from the floor. Now, before you do anything, please hear me. Do not attempt this if you have had a hip or knee replacement, if you have significant arthritis, if you have fallen in the past year, or if you are alone in the house and unsure. For a great many of you, this is one to watch rather than do. You will still get everything out of the segment, and I would rather you finish this video safely. Here is the test. From standing, lower yourself down to sit on the floor, then stand back up again. You start with 10 points. You lose 1 point every time you use a hand, a knee, a forearm, or the side of your leg for support on the way down or the way up. You lose half a point if you visibly wobble. So a person who lowers themselves down and stands back up using nothing but their legs and balance scores a perfect 10. Now here is why this matters. Researchers in Brazil at an exercise medicine clinic in Rio de Janeiro tested 2,002 adults aged 51 to 80 and then followed them for a median of over 6 years. The results were published in the European Journal of Preventive Cardiology. Every single point of improvement in that score was associated with about a 21% improvement in survival. A follow-up study published this year, tracking participants over 25 years, found death rates of 3.7% among those scoring a perfect 10, compared with dramatically higher rates in those scoring lowest. Now, I want to be careful and fair. This is observational research. It does not mean practicing floor rises adds years to your life. What it means is that this one movement captures an enormous amount at once. Lowering yourself to the floor and rising again requires leg strength, hip and ankle flexibility, balance, coordination, and a favorable ratio of muscle to body weight. There is almost no other single movement that tests all of those together. And here is why it matters in real practical terms beyond any statistic. If you fall at home and cannot get up unaided, you may lie there for hours before help arrives. The complications of that long lie are frequently worse than the fall itself. So this is not really about mortality tables. It is about whether a stumble becomes an incident or a catastrophe. If you cannot do this, or if you should not attempt it, that is genuinely common and it is fixable. Practice sitting down onto a chair and standing up without hands first, then a lower chair. Then, with someone present and a sturdy piece of furniture beside you, practice getting down to one knee and up again. Physical therapists teach floor transfers routinely, and it is one of the most useful things you can ask for. If you have fallen in the past year, please ask your doctor for a referral. Now, number 2, and this one you can do right where you are. It is called the timed up and go. Physical therapists and emergency departments use this constantly, and it takes about 12 seconds. Here is how it works. Sit in a chair with arms, feet flat. When you are ready, stand up, walk 10 feet, which is about 3 meters, turn around, walk back, and sit down. Time the whole thing from the moment you start to rise until you are seated again. Use your normal walking aid if you use one. That is completely fine, and it does not invalidate the test. Here are the numbers. The Centers for Disease Control, in its falls prevention program, uses 12 seconds as the threshold. An adult 65 or older who takes 12 seconds or more is flagged as being at increased risk of falling. Much of the research literature uses a slightly more generous threshold of 13.5 seconds. Adults without balance problems typically complete it in under 10 seconds. So if you did it comfortably in under 12, that is a genuinely good result and you should count it. Now, what makes this test so useful is that it is not one thing. It is a sequence. Standing up tests leg strength. Walking tests gait. The turn is the part most people do not think about, and it is where a great many falls actually happen, because turning requires you to shift your base of support while your body is already in motion. And sitting back down under control tests eccentric strength, which is the ability to lower yourself slowly rather than dropping. If your time was over 12 seconds, please do not panic about it. It is a screening threshold, not a diagnosis. But it is worth mentioning to your doctor because there are effective falls assessments, and the causes are often correctable. Medication side effects, blood pressure dropping when you stand, vision, foot problems, and simple leg weakness are all common and all addressable. If you are finding this useful, tell me in the comments how your timed up and go went. I read everyone. Number 3 is the one I think almost nobody watching has heard of, and it is beautifully simple. Ask a friend or family member to walk with you at your normal pace and then to ask you a question that requires a real answer, not yes or no, something like, "Tell me what you did last weekend." Now, the observation is this: do you stop walking in order to answer? That is it. That is the entire test. In 1997, 3 researchers in Sweden published a paper in The Lancet with the title "Stops Walking When Talking as a Predictor of Falls in Elderly People." It was extremely short, and it has been studied ever since. A systematic review published in the European Journal of Neurology examined the accumulated evidence and found that among older adults whose gait or task performance changed when dual tasking, the pooled odds of falling were substantially elevated. The reviewers noted the finding was strongest in frailer older adults. Now, why would this be? Here's the part I find genuinely fascinating. Most people assume walking is automatic. It is not. Walking requires continuous attention from your brain, and you simply do not notice because you have plenty of capacity to spare. As the brain's processing resources decline, walking begins to demand a larger share of what is available. Eventually, there is not enough left over to run a conversation at the same time, so the person stops walking in order to talk. They are not being polite, their brain is allocating resources. This is why so many falls in older adults do not happen during ordinary walking. They happen while carrying something, while talking, while turning to answer a question, while thinking about something else. The single task was fine, the two together were not. So if you can walk and hold a real conversation without slowing down or stopping, that is an excellent sign, and it tells you something about your brain as well as your legs. If you notice that you do stop, this is trainable, and the training is straightforward. Deliberately practice walking while doing something else. Walk and count backwards from 100 by threes. Walk and name as many animals as you can. Walk while carrying a glass of water. Physical therapists call this dual task training, and it is used precisely because it works. Just do it somewhere safe and level and hold a rail if there is one. Number 4 is your shoulders, and this one gets almost no attention at all. Try these 2 movements now gently and stop immediately if anything is painful. First, reach both arms straight up overhead as though you are putting something on a high shelf. Can you get your arms up beside your ears? Second, reach one hand behind your head and down your back, as if scratching between your shoulder blades. Then reach the other hand behind your lower back and up. Can you get the fingertips close to each other? Now, why does this matter as much as anything else on this list? Because shoulder range of motion is the hinge on which independent living quietly turns. Think about what those movements actually do in daily life. Getting a plate from an upper cabinet, washing your own hair, putting on a coat, fastening a bra or a back button, reaching a seatbelt, getting something out of the back seat of a car. When shoulder mobility goes, people stop doing those things themselves, and they very often do not mention it to anyone. They simply move the plates to a lower shelf and stop wearing certain clothes. It is one of the quietest losses of independence there is, and it is rarely asked about in a medical appointment. The good news is that shoulders respond well to gentle, consistent movement, wall walks, where you walk your fingers up a wall as far as is comfortable, done daily, help considerably. Doorway stretches for the chest help too, because tight chest muscles pull the shoulders forward and limit overhead reach. And if a shoulder is genuinely painful, stiff, or waking you at night, that deserves a proper assessment rather than stretching, because frozen shoulder and rotator cuff problems have specific treatments, and both are common after 70. And number 5 is one flight of stairs. Here is the test. Can you climb a normal flight of stairs at a steady pace without stopping to rest and hold a conversation at the top? Not a race, a normal pace. If you can, that is a meaningful signal about your cardiorespiratory fitness, which remains one of the most consistently powerful predictors of long-term health outcomes we have. Climbing stairs demands that your heart, lungs, circulation, and leg muscles work together under load. It is one of the few things in ordinary daily life that genuinely tests that system. And the conversation part matters, which is why I included it. If you reach the top and cannot speak a full sentence, that tells you something more than the climb alone did. Now, some honesty here. Knees and hips complicate this one, and plenty of people are limited by a joint rather than by their heart or lungs. If arthritis stops you, that is a different finding, and it does not say what the test is designed to say, so do not read a bad knee as a bad heart. But if you notice that stairs have become noticeably harder over months rather than years, that is worth mentioning to your doctor rather than accepting. Breathlessness that is new or worse than it was is not automatically aging. It can indicate heart failure, anemia, thyroid problems, lung disease, or valve disease, and every one of those is treatable and frequently missed. If stairs are difficult, the training is simply stairs. Start with a few, use the rail, rest as often as you need, and add 1 or 2 over the weeks. Interval walking works as well, alternating a faster minute with a slower one. Cardiorespiratory fitness improves at every age that has been studied. Now let me pull this together. Look at what these 5 share. Getting off the floor, standing, walking, turning, sitting, walking while talking, reaching overhead, climbing stairs. Not one is a blood test. Not one requires an appointment. They are all things you actually do in a normal week, which is exactly why they matter more than most numbers on a lab report. Because here is the distinction I wish more people drew. Lifespan is how long you live. Function is whether you can wash your own hair, get up if you fall, carry your shopping, and keep living in your own home. For most of my patients, the second one is what they actually care about. And function is far more responsive to effort than most people believe. 3 honest statements, as always. These come from observational research, which shows association rather than proof, and they describe groups rather than individuals. Existing joint problems, previous surgery, and neurological conditions all affect these tests without saying anything about how you are aging. And this video is education, not medical advice. I am a physician, but I am not your physician, and please do not attempt the floor test if you have any reason to be cautious. Now, a few things that warrant a phone call rather than a training plan. Any fall in the past 12 months, even one you got up from and told nobody about, because falls predict falls and there are effective assessments. A noticeable change in walking, balance, or stair tolerance over weeks rather than years. New breathlessness or breathlessness that wakes you at night. Dizziness on standing, which is extremely common, often caused by medications and very treatable, and sudden weakness, numbness, or trouble speaking, which is an emergency. Let me finish with what I said at the start. If you got yourself off the floor, if you came in under 12 seconds, if you can walk and talk at the same time, if you can still reach the top shelf and wash your own hair, and if a flight of stairs does not frighten you, then at 75, you are in considerably better shape than the internet has been telling you. And if 2 or 3 of those did not go well, then you now know precisely which 2 or 3 to work on, which is more than most people ever find out. That is not bad news. That is a plan. Tell me in the comments how many of the 5 you passed and which one surprised you most. I would guess it is the walking and talking one because almost nobody knows that is a real test. Take care of yourselves, and I will see you in the next one.